Thank you for visiting our booth at the American College of Physicians Massachusetts Chapter Annual Meeting. My name is Kelly Berry, and I'm a medical student from Tufts University, completing a research year with Drs. Marilyn Liang and Elena Harlock at Boston Children's Hospital. I'm excited to present one of our patients and share a non-invasive therapeutic option for pyogenic granulomas. Pyogenic granulomas are benign vascular proliferations of the skin that commonly affect children and tend to bleed easily. Most of the time, pyogenic granulomas do not spontaneously resolve and require treatment. Traditional treatments are procedural and can be invasive, costly, require an office visit, and can leave a scar. Examples include electrocautery, excision, laser, and intralesional injection. Limited access to live care during the pandemic has encouraged trial of non-invasive options for managing pyogenic granulomas. Non-invasive options may also be preferable for young children or for lesions in cosmetically sensitive areas. We present our case of a 3-year-old girl who initially presented to the emergency department with a 2-week history of a growing, intermittently bleeding lesion on the lower nasal area, clinically diagnosed as a pyogenic granuloma. The lesion was cauterized in the emergency department, and the patient returned for follow-up to the dermatology clinic 2 days later with a persistent, intermittently bleeding papule. At the time of presentation to our clinic, the papule was crusted but not actively bleeding, as seen in Figure 1A. Both procedural and topical interventions were offered, and her parents elected to trial topical clobetasol 0.05% daily under occlusion. At 2-week virtual follow-up, the lesion was significantly improved, as seen in Figures 1B and C, and by week 3 of treatment had completely resolved. No adverse reactions were noted. We share this case to demonstrate that topical 0.05% clobetasol applied under occlusion for a period of 2 to 4 weeks offers a safe, cost-effective, non-invasive alternative to procedures for pyogenic granulomas in an appropriate setting. The efficacy of topical corticosteroids is likely related to vasoconstriction and VEGF inhibition. Importantly, we do not recommend topical treatment for actively bleeding pyogenic granulomas, for lesions in which the diagnosis is unclear, or for patients seeking a fast cure. Topical treatment may, however, provide benefit in children, for lesions in cosmetically sensitive areas, for poor surgical candidates, or in patients with limited access to live care or awaiting procedural intervention. Lesions that fail to respond to topical treatment should be evaluated live and may require a skin biopsy for definitive diagnosis, as other lesions such as Spitz nevi and tumors are on the differential. Thank you so much for listening. Please scan the QR code if you would like to download or view our abstract, and we are happy to answer questions at our booth.